So can I ask something then, Callum? Because when I think of autism as someone who knows nothing about it, I often hear the autistic spectrum, and you also hear people talk about, oh well, everyone's on the spectrum somewhere. So clearly, it's not progressive, isn't the word, is it? But a disease with different effects at different things. I've always wondered where does the spectrum start? Is there like a definition point?
Yeah. So, one point of contention you just mentioned is you
Excellent.
referred to it as a disease,
Ah,
and that's quite an old-fashioned way of thinking about autism. It's considered as a difference that can vary in its impact on a person, and the spectrum component of it is really, really key, right? Um, all autistic individuals are truly unique. And whilst we know that there are certain characteristics that are common across individuals who are autistic, the presence and the intensity with which those characteristics manifest themselves can really vary a great deal. So, the way in which autism is assessed and identified is that, well, essentially, we have lists of criterial behavior that are known to be associated with autism, but not everyone who's autistic checks all the same boxes in terms of the presentation of those behaviors. So, this results in a lot of variability across the autism spectrum. So, as I said, there's differences in the presence, what kinds of behaviors and cognitive characteristics are present, and also their intensity. So, there are some folks who are autistic who their cognition, so their nonverbal intelligence, their language abilities develop very much in line with their chronological age. And you wouldn't, so they don't have any intellectual disabilities or anything like that. But there are other folks at the other end of the spectrum who do and can have really quite profound intellectual difficulties, can have really profound language learning difficulties. So some folks who are autistic won't speak or are minimally speaking, um, and also engage in very different kinds of behaviors as well.
okay.
Okay, so from that, I'm getting sort of that the autism spectrum is more about a spectrum of sort of symptoms you see as opposed to everyone's on the spectrum kind of thing.
That's right, and to be honest, that idea that everyone is on the spectrum isn't a helpful
Mm.
idea. I think many of the characteristics that you see in autism are or can be present in neurotypical individuals who aren't autistic, but the way in which they manifest themselves often has a more challenging impact on the life of a person who is autistic. Whereas they're not so much of an issue for someone who is neurotypical. And a good way of thinking about autism these days is like in my lectures, I show color wheels, right? So you've got all the spokes represent different kinds of characteristics that we know to be associated with autism. Um, and they can differ in terms of whether those spokes light up and how much they light up, indicating the intensity of those characteristics. And also on that slide, I show two different versions of the color wheel with different spokes and different lights and different intensities. And they both represent autistic individuals, but they just differ in terms of their experiences of autism and their particular unique set of characteristics.
So I guess, or in the introduction, I sort of, and you also alluded to language as a characteristic. What are sort of the other ones?
Yeah, so when we are assessing autism, it's funny actually. Language learning difficulties are a really common characteristic of autism, but these days they're not actually a diagnostic criterion. They are one of the things that parents identify and or makes parents seek a diagnosis or an assessment for their child, but they're not inherent to autism, right? There are lots of autistic individuals who have really fantastic language skills, are hyper fluent, and yeah, really great communication. The core areas for assessment are differences in social interaction. So these sorts of behaviors might relate to eye contact, for example. So often autistic individuals will not make as much eye contact in communication. Sometimes it can be anxiety inducing for autistic individuals to gaze. Although that being said, there are social strategies sometimes that autistic individuals implement. It might be that they can overcompensate and might sometimes make more eye contact than you would expect. But there's differences as well in for some autistic individuals, sensitivity and desire to engage in social interactions. So early on in life, sometimes children just they don't seem as keen to socialize as their neurotypical peers, and they don't seem to be getting the same reward out of social interactions and social feedback. Sometimes kids might not respond to their name, and this can lead parents to potentially think that their child is deaf. And this is because the child just isn't spontaneously orientating towards social stimuli in the same way. Um, Differences in what we call joint attention. So, joint attention is shared attention. So, if I point towards something in the environment and you direct your attention to that, and I'm looking at that, and we're having this shared experience or of kind of a sensory input. Autistic individuals make fewer bids for joint attention. They often won't try to manipulate a caregiver's attention in the same way, or they're also less receptive to joint attention. So they would be less likely to follow other people's bids. And also, you have restricted and repetitive behaviors and interests. That's the other core domain when it comes to um, assessing autism. And this often presents itself as, or it can present itself in lots of different ways. You've got repetitive behavioral movements. So sometimes that will be in the physical character, like physical movements of an individual. Sometimes you see sometimes there's like moving of the hands, and this can serve different functions. It can be soothing. It can help reduce anxiety. Um, as well as generating a sort of a sensory stimulation that might actually be providing some kind of positive reinforcement for the individual. You've got an adherence to often routine and liking predictable sort of routines to follow, and understanding how to structure the day, and really understanding if I perform this action, I know what's going to happen next, and being able to predict, essentially, yeah, predict what's going on and what's going to happen next. And also, you have special interests. So most autistic individuals have a topic that is really, really, really fascinating for them, and these can be hugely diverse, and often the individual's sort of knowledge and enthusiasm for this area or this particular topic might exceed their knowledge and understanding of other things more generally. So thinking about some of the children that I used to work with who did have really quite profound language learning difficulties, um, they might have had exceptional knowledge in this one area that will be far greater in depth than sort of general educational level.
Interesting. So, did you say it was entirely genetic, Callum, or is there an environmental factor behind it as well? Because I'm guessing it's the parents who presumably notice if a child, if they think it's he or she is autistic. I guess two, three-ish, somewhere around there, when they probably begin to talk. But is there then an environmental impact of where the child is and that changes autism, or is it purely genetic?
So it's a genetic condition. We know that because there is a heritable component of it. So we know that if in a family, a newborn infant has an older sibling who is already known to be autistic, or if parents are autistic, there's an increased likelihood of that infant themselves being identified as autistic. Um, there isn't any evidence for the way, like parenting
Mm.
practices or the way environments in which a child is raised, none of that reliably predicts the onset or assessment or identification of autism. So it is very much a genetic condition. We just,
Don't know the gene.
I think, yeah, we just don't know the gene. And because of the variability within the population, it's probably that it's really polygenetic.
Yeah.
There's lots of interactions between different genes um, and this is results in the variability in cognition and behavior and so on. There are certain prenatal factors, like environmental factors, that we know to increase the likelihood of autism occurring. So maternal age, for example. And I read a paper recently that talked about certain conditions during pregnancy. So, if there's a threatened miscarriage, for example, that's associated with increased likelihood of the infant being autistic.
I vaguely remember reading this for a completely different study, but certain things about famine and all during pregnancy as well, sort of relating to higher risks of mental health disorders and autism. I was reading it for something else, but I vaguely remember this. Is this also true,
Yeah.
possible, to the
So I
same
think
extent?
that feeds into the idea that maybe prenatal environment could have an influence, and it might be that those kinds of prenatal factors might well be sort of triggering epigenetic type relationships and effects that are going on potentially.
Oh. So question, are you, so you're telling me vaccines don't cause autism?
Um, I'm absolutely telling you that vaccines don't cause autism.